What medicines to take on a trip? Today I will tell you what medicines I took to the Seychelles. Seychelles. Paradise islands, stunning beaches, luxurious villas, rich nature, space recreation. The main thing is that this vacation should not be spoiled by health problems. In this video, I will share with you how I assemble a travel first aid kit. First of all, I start at the country I'm going to travel to, and I think about what can happen to me there and what first aid I can provide to myself and my loved ones. The sun. Seychelles is a very sunny country. The sun shines for about 7 hours a day. I love the sun, but after I was badly burned in the Philippines, I stopped specially frying in the sun and generally began to very carefully dose my exposure to the sun. I burned out so badly that the skin on my forehead peeled off, my face was very swollen, and more moles appeared on my body. So we definitely need sunscreen. And I'm not just talking about clothing covering the body, hats like caps, bandanas, and also closed shoes. Remember that the dorsal surface of the feet burns out very quickly. We also need sunscreens for our skin. This can be creams with SPF 50 and above. Remember that creams need to be reapplied because they are absorbed over time and washed off after bathing. Coconut oil can be applied before sunbathing. Just be careful, buy natural coconut oil. How can you tell if it's natural? Very simple. It should freeze at room temperature 19-23 degrees Celsius. The oil perfectly moisturizes the skin, protects against burns, and gives your tan a beautiful bronze tint. After sun exposure and fresh water shower, apply aloe vera balm to your face and body. It moisturizes and nourishes the skin so that after a week you will not turn into an old shriveled tangerine. If you're still burned out in the sun, I can advise you 3 remedies for healing. First, Atoderm sauce spray from Bioderma. Second, multi-purpose Ayurvedic cream, Kailas Jivan. And third, just don't laugh, hemorrhoid cream. Seriously, hemorrhoid cream is great for sunburn. This is an off-label application, and if you suddenly get sunburn, consult your doctor before using it. Do you want the best sunburn remedy anyway? Avoid the sun from 10 a.m. to 3 p.m. Wounds. In any country, in any place, one can get an injury, a cut, an abrasion. Therefore, we definitely take an adhesive plaster on the trip. I have 3 types of them, strips and 2 types of rolls. I took 2 types of antiseptics, 0.05% chlorhexidine and 1% chloramphenicol, as well as sterile gauze wipes and medical glue. Many times I have been helped out by antiseptic powder banocin or banocin. It can be applied to open wounds during wound care. The Seychelles has a hot, humid tropical climate. In such an environment, purulent wounds can form. In this case, Vishnevsky ointment will help a lot. I don't know if there is something similar in your country or if it's a purely Russian ointment. The composition contains tar and a bismuth complex. The ointment miraculously draws out pus from the depths of the skin, subcutaneous tissue, and copes well with small wounds. But naturally, it has limitation in its use. With prolonged use, it can cause skin irritation. It is used with caution on open wounds and does not work on all wounds. If the wound is deep, an encapsulated abscess or phlegmon has formed, you will definitely need the help of a surgeon who will open, remove, and treat a complex wound. Do not waste time and do not lead to complications. Therefore, take the means for treating wounds with you, but without fanatism. It is better to consult qualified doctors. I also took 2 anti-inflammatory ointments, hormonal hydrocortisone ointment and non-steroidal anti-inflammatory ointment diclofenac, and also an elastic bandage, a kind of soft orthosis for fixing a small joint, wrist or ankle. Insect bites. Seychelles is a great place not only for people but also for all kinds of insects that wants to drink our blood, just bite or sting. I have aloe vera mosquito spray, hypoallergenic, 0% alcohol. Cordyamine solution, active ingredient nicotinamide, also works well against blood-sucking insects. Pour the undiluted solution into a spray bottle and apply to the skin. This solution works for 1–2 hours. Check yourself for hypersensitivity before use. Apply a small amount of mosquito or cordyamine spray to the crack of your elbow and watch for any breakouts in this area within 1–2 hours. If not, then you can safely use it. A friend of mine, thank you Tina, recently gave me a gorgeous product which I later saw in the Ayurvedic store. I already talked about this remedy when I talked about sunburn. This is multi-purpose Ayurvedic cream Kailas Jivan. It can be used not only for sunburns, but also for insect bites, for various damages to the skin and mucous membranes, burns, injuries, rashes, frostbite, hemorrhoids and cracks, and even with gastrointestinal disorders. Yes, this remedy can not only be applied to the skin and mucous membranes, but also taken internally. An excellent natural remedy with coconut oil and medicinal herbs. Pain relievers. Everything is simple here. You take on the trip those medicines that usually help you. I took a light pain reliever Citramon in the composition of acetylsalicylic acid, caffeine, paracetamol, dexalgin or dexketoprofen. This is a non-steroidal anti-inflammatory drug. Spasgan in the composition of metamizole sodium, pitophenone hydrochloride and fenpivirinium bromide. After some procedures with my health, I almost completely got rid of migraines, but sometimes they still happen. Write in the comments below if you are worried about headaches, if I should make a video on migraines and headaches. Abdominal pain and upset stool. I took esomeprazole on the trip. It is a proton pump inhibitor, a drug that lowers gastric secretion. It is used in the Helicobacter pylori eradication complex for the treatment of peptic ulcer disease and the prevention of its recurrence. Esomeprazole may help relieve abdominal pain caused by gastroesophageal reflux. I also took Ecofuril nifuroxazide, which is an intestinal antiseptic, antidiarrheal drug. Well, logically, if there is a remedy for the diarrhea, then there must be a remedy for constipation. Microclysters and Senade, a laxative drug that stimulates intestinal motility. On vacation, you can sometimes overeat delicious food. So in case of overeating, I have Creon, a digestive enzyme, and Spumizan, a carminative. Runny nose, sore throat and ear pain. In March, I brought excellent medicines from Turkey, including Prosil throat spray with propolis and vitamin C, and propolis spray, Prosil nasal spray. This is the strongest spray that draws out all the snot not only from the nose, but it seems from the sinuses. There is a softer spray and also quite effective. This is Isofra Framicetin. For a sore throat, I gargle with Kyst Al Hindi tincture or furacilin solution. There is already a video about Kyst Al Hindi on my channel. This is a natural antiseptic and antibiotic. Furacilin is a synthetic antimicrobial agent for external and local use. Dissolve 1 tablet in a glass of warm water and gargle. Then you can spray with the above-mentioned Prosil spray with propolis and vitamin C. For otitis media and ear aches, I found a very effective remedy called Anauran, which I brought from Italy. You put 1–2 drops in the ear, lie like for 1–2 hours for 3 days, and usually the ear problems go away. In general, I like to bring cool medicines from different countries, mostly vitamins and supplements. In some cases, I have to use antibiotics. Of course, they need to be chosen individually. Take into account sensitivity. Sorry, I wouldn't tell you what exact antibiotics I took on this trip. These drugs should be prescribed by your doctor. And emergency drugs. My first aid kit, which I take on a trip, includes strong painkillers, dexamethasone, a glucocorticoid, an emergency drug for cerebral edema, post-traumatic, post-burn, toxic shock, for severe allergic reactions, for anaphylactic shock, and for some other emergency cases. Codiamine, analeptic, indicated for collapse, shock, suffocation, for depression of respiratory function and blood circulation. Since I flew to the Seychelles with my mother, I took drugs to lower blood pressure, Noshpa, Dibazole, Papaverine, and also Euphyline, a drug that improves breathing. Naturally, I take syringes for injecting all this stuff and antiseptic wipes. I must warn you, these are very serious drugs that can only be used by a doctor or other qualified specialist. Do not mix drugs in one syringe and don't use them without your doctor's advice. Hand luggage. As you can see, I prefer natural medicines and supplements, but when necessary, I can use chemotherapeutic pharmacological drugs. The main thing is that the benefits of the drug should outweigh the harm from it. In the cabin of the plane, I take adhesive plasters with me, some feminine hygiene stuff, Corvalol, a mild sedative with min and phenobarbital, furacilin, a local antiseptic, a nasal inhaler, and menthol ointment. The last two pieces are magic tools that saved me many times during the flight. If you feel worsening, decreased pressure, nauseated, use an inhaler and apply the ointment on the wings of the nose, above the upper lip, and on the temples. And after a couple of minutes, you feel better. Hope this video was helpful for you. Write in the comments what products you usually take with you on a trip. Always consult your doctor or other healthcare provider. Remember, it is better to be safe than sorry. Take care of your body and mind, especially when traveling.